Hello, everybody, and welcome to this week's episode of Medisodes. This week, we're going to be talking about a part of the body that you might not know much about and might even think is useless. Today, we're going to be shedding light on the appendix. The human appendix is the subject of today's discussion, although it is interesting to note that only rabbits, rodents, apes, and humans have appendices, not cows, pigs, sheep, even monkeys or any other mammals that you would think have them. Also known as the vermiform appendix, vermiform being from the Latin meaning worm-like, the appendix is a finger-like tube connected to the cecum, a pouch at the beginning of the large intestine, located at the junction of the small and large intestines. The human appendix averages 9 centimeters in length, but can range anywhere from 5 to 35 centimeters. The longest appendix ever removed from a person was 26 centimeters long. The diameter of the appendix is fairly consistent, however, at around 6 millimeters, and anything more than 6 millimeters is considered a thickened or inflamed appendix. The appendix is usually located in the lower right quadrant of the abdomen, near the right hip bone. The base of the appendix is located 2 centimeters beneath the ileocecal valve that separates the large intestine from the small intestine. Its position within the abdomen corresponds to a point on the surface known as McBurney's point, which is used by doctors and surgeons for locating it. While the base of the appendix is typically located 2 centimeters below this valve, the tip of the appendix can be variably located in the pelvis, outside the peritoneum, or behind the cecum. And all these positions have varying prevalence in the human population. In around 64% of cases, it is retrocecal, or behind the cecum. When I say behind and in front of, assume the person is being viewed from their front. In around 0.5% of cases, it is post-ileal, next to and behind the small intestine. And then in 1% of cases, it is pre-ileal, next to and in front of the small intestine. In around 32% of cases, it protrudes towards the pelvis downwards, and in 2% of cases, it is subcecal, or beneath the cecum. This prevalence of the different positions actually varies amongst populations, with the retrocecal position being most common in Ghana and Sudan and other sub-Saharan countries, with 63.3% and 58.3% occurrence respectively. This compares to Iran and Bosnia, where the pelvic position is most common, with 55.8% and 57.7% occurrence respectively. So the appendix, although it's consistent amongst all humans, changes a lot between people. And now on to Shrey, who's going to tell you more about what the appendix actually does.
So many of you might think that the appendix is a useless organ from our evolutionary story that has no use today. However, this is only half true. The appendix does serve a purpose. That purpose is just not needed anymore. Over the last decade, scientists have discovered that the appendix is a store of good bacteria from the gut, as well as lymphocytes. If the gut is cleared out by an illness, such as diarrhea, then good bacteria in the appendix can repopulate it before more harmful bacteria can get to it. And different gut bacteria are useful in developing lymphocytes. The lymphocytes are trained basically and are trained with these different bacteria so that they don't start to attack the gut bacteria and they only attack foreign bacteria. So this is very useful in the immune system. Also, in the fetus, endocrine cells appear in the fetal appendix around the 11th week of development. And the endocrine cells in the fetal appendix produce biogenic amines and peptide hormones, which assist with homeostasis, which is obviously a very important biological process. Apart from the biology of it, the appendix can also be useful in surgery. In previous years, the appendix has often been removed during abdominal surgery, and this is to eliminate the risk of appendicitis, which is very, very painful. But recently, it is now being kept in order to be used in reconstructive surgery. So, for example, if your bladder is removed, maybe you have bladder cancer or some other issue, a section of the intestine is formed into a replacement bladder, and then the appendix is used to recreate the sphincter muscles between them so that the patient still remains continent. Continent means able to retain urine. So it's obviously very important that that's still there after the bladder is removed. The appendix can also be fashioned into a makeshift ureter, which allows urine to flow from the kidneys to the bladder, which is obviously also very important. So, although the appendix is not very important and you can do without it, it still serves a purpose. Now, on to Shri to tell us about appendicitis.
So now we will be looking at appendicitis. Appendicitis is the inflammation of the appendix. Symptoms of appendicitis include pain in the middle or right of the abdomen and moves down to the lower right abdomen or pelvis. However, pregnant women usually experience pain in the upper abdomen because the appendix is higher during pregnancy. Other symptoms include nausea, vomiting, fever, and increased urination frequency, to name a few. Loss of appetite and diarrhea are also common symptoms. Appendicitis occurs when the opening to the appendix is blocked, for example by feces, or due to infection, like a viral infection. When the opening to the appendix is blocked, bacteria start to multiply in the gut. This causes the appendix to fill up with pus and swell, hence the inflammation. Appendicitis is quite a common condition, and according to the NHS, around 50,000 people are admitted to hospital with appendicitis each year in England. Appendicitis also usually occurs between people aged 10 to 20 years, but it can develop at any age. In the US, it is estimated that 5% of the population will develop appendicitis during their lifetime. The exact causes of appendicitis is unknown, so it can be difficult to understand why it is so common. One possibility is the fact that there are a variety of viral, bacterial, and fungal infections that can lead to appendicitis. The mortality rate of appendicitis is roughly 0.2 to 0.8%, and this is largely due to the complications of the disease rather than death during treatment. Appendicitis is usually treated by removal of the appendix. And now on to Adrian, who will be talking more about the treatment of appendicitis.
Testing and diagnosing appendicitis is just as important as treatment. It is a waste of resources and brings unnecessary risk to the patient should surgery be the only way of confirming a case of appendicitis when a patient displays symptoms. Instead, a wide variety of different techniques are used in the diagnosis of appendicitis. To check for signs of infection, the doctor may order a complete blood count, in which a sample of blood is collected and sent to the laboratory for analysis. Appendicitis is often accompanied by bacterial infection, and so an infection in the urethra or other abdominal organs may cause symptoms similar to those of appendicitis. To rule out urinary tract infection or kidney stones as a potential cause of symptoms, urine analysis, in which a sample of urine is collected for analysis in the lab. A pregnancy test may also be carried out in the route for diagnosing appendicitis. Ectopic pregnancy can be mistaken for appendicitis, and it happens when a fertilized egg cell is implanted in the oviduct rather than the uterus, which is in itself a medical emergency. Abdominal imaging tests are also used to check for inflammation of the appendix. This can also help identify other potential causes of the symptoms. Imaging techniques include abdominal ultrasound, abdominal X-ray, abdominal CT scan, and abdominal MRI scan. In rare cases, a doctor may also order a chest X-ray, because pneumonia is in the lower right lobe of the lungs can also cause symptoms similar to appendicitis. Now, onto the different types of treatment that exist for appendicitis. Surgical removal of the appendix, known as appendectomy, is one of the most common operations in the UK and has an excellent success rate. Given the commonality of appendix, especially in comparison to other illnesses treated with surgery, surgeons are often most experienced in appendectomy.
Keyhole surgery, known more formally as laparoscopy, is often sufficient for this type of surgery. Keyhole surgery is a type of surgical procedure that allows the surgeon to have access to the inside of the abdomen and pelvis without having to make large incisions in the skin. The use of a laparoscope, hence in laparoscopy, reduces the need for larger incisions. It is a small tube with a light source and camera, which relays the images of the inside of the abdomen or pelvis to a television monitor. Other tube-like tools are also used to perform the actual surgery. The benefits of using keyhole surgery over traditional open surgery include a shorter hospital stay and faster recovery times, less pain and bleeding after the operation, and reduced scarring. Of course, keyhole surgery is not limited to appendectomy, but can be used to help diagnose a wide range of conditions that can develop inside the abdomen or pelvis. For example, keyhole surgery can be used for the removal of a tissue sample for further testing, a technique especially useful in the diagnosis of cancer. In some cases of appendicitis, keyhole surgery may not suffice, and a traditional open surgery may be required. In open surgery, a single, larger cut is made to the abdomen. This technique is usually used if the appendix has burst, or if access is more difficult. It generally takes about 2 weeks to make a full recovery after the appendix has been removed, but strenuous activity may have to be avoided for up to 6 weeks after having open surgery. Other treatments do exist, but they are ultimately pre-treatments for the surgery to remove the appendix. These include needle drainage to remove an abscess, which may be a potential cause for similar symptoms to appendicitis, antibiotics because appendicitis is commonly associated with bacterial infection, and pain relievers to suppress the acute lower abdominal pain that appendicitis causes. Of course, as this is the case with all diseases, illnesses, and disorders, prevention is better than treatment. However, it is still not clear what causes appendicitis, and several different possibilities have been suggested, though no one knows for sure. For example, it could become blocked, and this obstruction may cause inflammation and swelling, which then leads to increased pressure within the appendix, which may then burst. Some have also suggested that a high fibre diet leads to a reduced risk of appendicitis, with people in countries where the diet is higher in fibre, typically Asian countries, having lesser risk of developing the condition, as those with diets having lesser fibre, typically the Western world, where diets contain more carbohydrates. More research is needed on the potential role of diet. And now I'll hand back over to Anupam to wrap up today's episode.
So hopefully from today's episode, you've learned a lot more about the appendix and understood why this part of our body is there, even though it does cause appendicitis in many people. It's really important. And thank you for watching this episode. Make sure to like, comment, and subscribe for new episodes every week on the Medisodes channel.